Well, did you know that over half of us here in the States will develop heart disease? The good news is that it is preventable. Dr. Todd Hurst, who's a cardiologist and the medical director of the Mayo Clinic Heart Health and Performance Program, is here to tell us about an innovative program to help learn if we're susceptible for heart disease. And welcome, Dr. Hurst.
Thank you. Pleasure to be here.
I want to talk about that in just a moment, but first of all, let's talk about who's really at risk for heart disease.
Well, that's a great question. Really, the data is that most people are at risk. A recent study showed that about 60% of men and not many less women are going to develop heart disease in their lifetime. Now, there are certain factors that we're certainly concerned about being even higher risk. Those who smoke, with diabetes, high blood pressure, or a family history of heart problems are a particularly high risk.
It seems like in today's age, it's so much more than just hereditary because of our lifestyle. You know, who's the candidate? I mean, what's wrong with their lifestyle besides hereditary? Like you said, smoking, and I'm sure diet plays a part of it.
Absolutely. You know, probably the best thing that somebody can do for their health in general, avoiding heart disease and cancer and all the other health problems, is eat a better diet and move more.
Eat right and exercise. Boy, we hear that a lot, don't we?
All right. Easier said than done.
You're absolutely right about that. So let's talk about when somebody might be concerned about whether or not they are a candidate for heart disease, and I'm assuming the first thing they need to do is to come to you for a consultation. And what happens at that consultation?
It's a great question. Now, it's one of the things that is traditional medicine. We've been really good at taking care of people once they develop sickness, once they're ill. But at Mayo Clinic, we wanted to take a more proactive approach.
I like that.
We've developed a program called the Heart Health and Performance Program that really is designed for those people that are concerned about their risk for future heart disease. Through that program, individuals see a nurse practitioner who is an expert in prevention, a cardiologist, but real strength of the program is the time that they get with real experts. An hour with a dietitian, an hour and a half with an exercise physiologist.
Wow.
To optimize their health for the future.
This is very comprehensive. So you're telling people they can come in before they're experiencing any type of symptoms?
Absolutely. In fact, I think that's the real key. You know, about 25% of people, the first sign that they have heart disease is they die. So waiting for those events to occur.
It's too late by that time.
Exactly. It's just too late. Yeah. And the good news, though, that's the bad news. The good news is that if we can identify those people that are at risk before they have their events, we have effective means to prevent those problems. All
right, so once you determine after your consultation, which is very comprehensive, you have this, and I know that you have a really cool name for it, an ultrasound basically, to determine, and during this ultrasound, are you actually looking at the heart at this point, and what are you looking for?
Yeah, another good question. Now, once we've gathered all that information, the history and physical and the lab testing and things, oftentimes we're still left with questions. Does this person make more artery disease than they should? One of the tests that we use to answer that is an ultrasound test called the carotid intima media thickness, or CIMT. What we use is ultrasound to look at the neck arteries, and from that we can tell how much artery disease you make. And in fact, we can tell how old your arteries are compared to how old you are.
Really? Is that what we're seeing right here?
Exactly.
This is the artery of someone's neck. And,
exactly.
And obviously, if it's older than it should be, then your advice then would start to be taking steps to prevent. Does that mean they have heart disease, though?
Yeah, exactly. No, it doesn't mean.
Okay,
having heart disease
good.
Means you have to have a clinical event, heart attack, stroke, heart failure, that kind of thing. But what we know from the prior studies with this test is that if somebody has thicker artery walls than is normal, or if they have plaque, which is already artery disease forming, that they're at higher risk for future events. And so that may impact how aggressive we want to be with their prevention recommendations.
So let's say at this during this test you determine that the artery's older than it should be. Then what happens with that particular patient? How do you help them?
Yeah, it's a complex thing, and it really depends on the individual, but we really most strongly emphasize lifestyle changes. Exercise and eating a healthy diet, those are good for lots of things, not just for the heart. But some people need more aggressive prevention even on top of that. And most of the time we're talking about medications in that standpoint. Medications to lower blood pressure if their blood pressure is too high, but most of the conversations will be around cholesterol-lowering medications called statins.
Okay.
Statin medications are the most studied medications in the history of medicine, and they're our most effective means for preventing future heart disease problems in people that are at high risk.
Would it be fair to say that you're possibly stopping it in its tracks, or maybe even reversing it and prolonging your life,
Absolutely,
a healthier life?
Absolutely. Good evidence that people on good prevention regimens, on statin medications with their LDL cholesterol, the bad cholesterol at low levels, that we arrest that progression of the artery disease, and even some evidence of a slight regression.
Wow. Good information, very interesting, and I know our viewers at home, I mean, you know, we're huge here in a partnership with Mayo Clinic, and we appreciate them visiting us every month on the 15th. ABC 15 has teamed up with Mayo for this campaign. Each month, we'll give you tips and tricks to help keep you and your loved one's heart healthy. To learn more and get our Rally for Red reminders, just sign up at abc15.com/rally for red. Thank you so much, Dr. Hurst.